Thank you. Good evening, everyone. And thank you to our amazing speakers, so inspiring. And I feel that with people like you and all of us campaigners, the NHS is in good hands because we are going to fight for it very powerfully. I'm speaking on behalf of Keep Our NHS Public, which is one of the founding organisations of SOS NHS. And the whole idea of SOS NHS was to bring together all the organisations, all the campaigners and the trade unions, all with the common goal of fighting to defend our NHS. Keep Our NHS Public, we call it COMP for short, slightly awkward phrase. It's going to be 20 years old next year. And it's a sad reality that we are still needed. And in fact, the NHS is in far worse shape than when COMP began in 2005, with more than a decade of underfunding, increased privatisation, repeated reorganisations, taking it further from its founding principles, and a staffing crisis that makes it harder than ever for the NHS to function properly. Since its inception, COMP has had several notable successes. And I want to say that because I think things would have been even worse had it not been for campaigners over the last decade and a half. Campaigners have helped to save 10 hospitals. We've saved numerous NHS services. We've highlighted the dangers of privatisation, cuts and underfunding, and we've stood shoulder to shoulder with health workers, fighting for better pay and conditions, such as the staff of SNF that Matt talked about tonight. In the run-up to the general election, COMP launched our Restore the People's NHS campaign. I was going to hold that up to show people. Restore the People's NHS campaign. That called for a publicly provided NHS with adequate funding, decent pay and conditions for all health workers, reinvestment in public health to tackle health inequalities, and importantly, to rebuild and expand our NHS to make it better, to not just to defend what we have, but to actually make it better, to start to talk also about improving and investing in and reforming social care, which is so closely linked to NHS care. Everyone cheered, well, maybe not everyone, but lots of people cheered at the end of the Tory government's 14 years of damaging and destructive policies that brought the NHS to its knees. But the demands of the Restore the People's NHS campaign are as relevant and urgent as before the election. The promised increased funding is not enough to make up for over a decade of underfunding, and Labour thinks it can avoid increased investment by various strategies that we've heard about tonight that are all doomed to fail. For example, their commitment to use the private sector to bring down waiting lists, seemingly without having learned any lessons from previous attempts to use the private sector, which failed miserably. And we saw that very much during COVID. Last time waiting lists were successfully brought down, under the last Labour government, ironically, was due to investment in NHS staff and capacity. It wasn't due to the private sector. Similarly, Labour is ignoring the evidence of the damaging impact of privatisation on existing NHS services, the latest example being private provision of cataract surgery, which has actually reduced the capacity of the NHS to provide this service. Labour says there won't be any more money without reform. And I'm very worried, we're all very worried about what sort of reform that will be. It's extremely worrying that Alan Milburn has been appointed as a senior advisor. He was the architect of Labour's failed privatisation first time round. We've heard it all before, this idea of the shift from hospital to community care, from treating sickness to preventing it. Nice ideas, I'm all in favour, we're all in favour of more investment in community care and in prevention. But none of these in themselves will solve the NHS's problems. And continued underfunding, attacks on staff, demoralising them with ridiculous league tables, and increasing privatisation, as I said, is doomed to fail. And that's very worrying, because what we've got, if we've got an NHS already on its knees, and we've got a government that has no strategy, no effective strategy to help it to recover, then we're going to see further decline, further crisis. We're going to see a really horrible winter crisis. now. I mean, the NHS should have had a massive injection now of extra funding to cover that, and it's going to continue to deteriorate. And then what will happen? The NHS will be blamed, and the cry will go up, oh, it's the model that's wrong. It's a failed model. The NHS is broken. We don't like that phrase, NHS is broken. It's not broken. Yes, it's on its knees. Yes, it's suffering. Yes, it's struggling, but it's not broken. Because after this phrase, the NHS is broken, the next thing you hear is it's the model that's wrong and it has to be replaced. Thank you. Lessons of the last Labour government. I've got a note here because I wanted to remind, well, sometimes I have to remind myself just how old I am. I was a GP under Margaret Thatcher, and I saw the horrible impact of those of the deprivation and the attacks on the NHS then, with the long waiting lists, people lying on trolleys for hours, and services being cut. And I do remember the last Labour government, and it did make a difference. Credit where credit's due. It did make a difference in all sorts of ways. But the main difference it made was because, as Richard said, it had a 6 to 7% annual increase in funding. That's why it made a difference. The things that didn't make a difference, the things that made things worse, were their experiments with privatisation, with PFI, etc. So let's build on the positive lessons of the last Labour government, and let's look at what the Keep Our NHS Public is saying its 3 shifts should be. The government talks about 3 shifts. We've got our call for 3 shifts. First, away from underfunding and to funding the NHS so it can succeed. Away from private outsourcing and to building back publicly provided NHS services, and away from the fragmentation of services to a reuniting of the national NHS as a public service, publicly provided, publicly funded. And fourthly, very importantly, the establishment of a national service for care, support, and independent living. How do we fight for these? Just going to sum up now. How are we going to fight for these? Well, we need to continue having strong local and national campaigners working together with the trade unions in SOS NHS. It was good to have MPs speaking today. We need to work with you so you can speak out in Parliament for a restored, wholly public NHS and social care, and as well as continuing to stand with campaigners and unions in our struggles in the community and in our workplaces. We need the public's voice, like Matthew Hulbert today from Just Treatment, saying how urgent it is to build back the NHS. This is incredibly urgent. We must remember how much people are suffering, patients and staff as well. And we need to continue to bring local campaigners and unions together to support each other and to support NHS staff and to fight for a properly funded, publicly provided NHS. If you're in an organisation, please do join or sponsor SOS NHS. And if you're an individual, please join Keep Our NHS Public. It's only by being organised, coming together and being strong that we're going to have any chance of defending and improving our NHS to make it fit for the future. Thank you.